eye education is the basis. You see, at some stage, we need a hip replacement ourselves. So we are lucky and fortunate to have somebody who does a proper job with hardly any complication, with the newest technique, and also with the new surgical approaches and techniques that are available. So it's not just selfish, but I think it's just to improve the patient care now and in the future. I think one of the big benefits we've got real cadaver. I think that's one benefit. So we don't have really embedded cadavers in formalin, so they're really fresh. So that's one thing. The second thing is just the ratio between the participants and faculty. So we've got a ratio of 2:1. So you can benefit enormously because you can interact directly, you can ask questions, and you get the answers. Hopefully, the right answers. And also the faculty, they're also highly skilled. They all have got a huge knowledge, and I think that's a huge benefit. And being in Bern, the main capital city of Switzerland, I think it's a wonderful city as well. So I think it's a hands-on. I think that's the main part of the whole course, the hands-on, the practicals in the afternoon. But of course, if you have never done maybe a procedure, maybe it's important that maybe if you first see a video or slides with tips and tricks from the experts. But I think yes, the main part is definitely the hands-on in the afternoon.